Icariin is the main active compound of Epimedium plant, which is commonly known as horny goatweed. These plants are traditionally used in China as aphrodisiacs and to enhance erectile function. Limited research suggests the icariin can also help to repair bone fractures, reduce stress, and improve mood. Icariin is an active flavonoid component of the Epimedium plant, commonly known as the horny goatweed, and extracts from the plant have long been used in traditional Chinese medicine for enhancing libido and male sexual function. Due to its widespread distribution and movement in the body, including the brain, the icariin exhibits several potential biological activities, such as an antioxidant and an anti-inflammatory, for neuroprotection, for anti-tumor activity, as well as promoting overall health in the heart, the bones, and a variety of other organs. Icariin increased hip and lower spine bone density in a clinical trial on 100 postmenopausal women by inhibiting a bone breakdown marker and by maintaining a bone formation one. Similarly, icariin improved bone mineral density and strength in female rats with removed ovaries. Icariin also promoted the production and the activity of bone cells or osteoblasts based on the results of cell-based studies. It stimulated the generation of cultured human bone cells by increasing bone morphogenetic proteins, a key protein involved in bone and cartilage formation. It also enhanced the production of primary osteoblasts by increasing bone formation marker ALP, osteocalcin, COL1, and OPG, and by decreasing RANK-L, a protein involved in osteoclast formation. Icariin inhibited the formation and the bone reabsorbing action of osteoclasts. Osteoprogerin is known to inhibit the RANK-L activity, and this plays a role in osteoclast formation and bone destruction. In addition, the icariin may suppress the osteoclast formation by decreasing superoxides, reactive oxygen species that are required for the osteoclast survival and activity. It can also inhibit cartilage and bone breakdown in arthritic mice. In a small trial on 10 people with bipolar disorder and alcohol abuse, icariin at up to 300 mg per day reduced depressive symptoms and alcohol consumption. The hypothalamic pituitary adrenal axis plays a role in mitigating physiological responses to stress, with hyperactivity implicated in depressive and anxiety disorders. The icariin normalized the hypothalamic pituitary adrenal axis activity. Cytokines, interleukin-6 and TNF-alpha activate CRF, and this increases the hypothalamic pituitary adrenal axis activity, characterized by high levels of cortisol, the stress hormone. So, icariin can act as an antidepressant by decreasing the hypothalamic pituitary adrenal axis hyperactivity through the inhibition of the CRF and the cytokine levels in the depressive patients. In a clinical trial on 80 men with lifelong history of premature ejaculation, PDE5 inhibitors, like are found in horny goatweed, delayed ejaculation from vibratory stimulation. Icariin inhibits phosphodiesterase type 5, an enzyme that breaks down cyclic guanosine monophosphate, or cGMP. PDE5 inhibition stimulates the nitric oxide cGMP pathway, and it improves reproductive function in animal models. This is due to increased cGMP and nitric oxide levels, which lead to smooth muscle relaxation, widening of blood vessels, and increased blood flow to the penis, facilitating an erection. Chronic treatment of icariin suppressed penile smooth muscle cell death in multiple animal studies. Additionally, the icariin significantly increased pelvic nerve length when cultured with nerve fragments, indicating it may enhance penile rehabilitation. It also increased free testosterone levels in rats. Research indicates that high levels of testosterone are correlated with increased sexual desire in aging males and females, suggesting that icariin may act as a natural aphrodisiac in individuals with diminished libido. Icariin exhibited anti-amyloid activity in many animal studies. Beta-amyloid peptides are proteins that cause plaque formation and cell damage in Alzheimer's disease. Icariin was shown to markedly decrease beta-amyloid-induced toxicity in rat adrenal embryonic cells by inhibiting tau protein, a key biological marker of Alzheimer's disease. Icariin also exhibited protective effects against learning and memory deficiencies in animal models, and improved dementia in aluminium-intoxicated rats by reducing oxidative damage and beta-amyloid deposits in the hippocampus. This is in part due to the increased superoxide dismutase, an enzyme that reduces oxidative damage. In rats with brain inflammation, short-term icariin treatment improved spatial learning and memory abilities. This effect is thought to be due to the lowering of the pro-inflammatory cytokines, as well as COX-2, an enzyme responsible for fever, inflammation, and pain. It can also suppress neuroinflammation by inhibiting the activation of microglia, macrophage-like cells in the brain's nervous system that play a pivotal role in initiating the neuroinflammatory response. The anti-inflammatory effects of icariin may be attributed to its inhibition of the NF-kappa B and the p38-MAPK pathways, which are involved in microglia and pro-inflammatory marker activation. Another animal study showed that icariin lessened cognitive decline by increasing brain-derived neurotropic factor and its receptor tyrosine kinase TRKB. Brain-derived neurotropic factor is a neurotropic factor involved in cognition, synaptic plasticity, and neuronal survival. In rats recovering from a stroke, icariin protected against cognitive deficits by increasing acetylcholine metabolism in the hippocampus, a key neurotransmitter involved in learning and memory. In addition, the icariin may enhance cognitive function via the stimulation of the nitric oxide cGMP pathway. Elevated levels of the cGMP and the nitric oxide improve brain blood flow, synaptic plasticity, neurovascular dysfunction, and beta-amyloid plaque elimination from the hippocampus or the memory center and from the cortex. Due to its potent anti-inflammatory, antioxidative, and anti-amyloid activity in the brain, the icariin may serve as a promising therapeutic option for cognitive disorders like Alzheimer's disease and other forms of dementia. Icariin inhibited neurotoxicity induced by corticosterone, aluminium, hydrogen peroxide, and other toxins, and it promotes neuronal survival in numerous animal models. It suppresses neurotoxicity by maintaining intracellular calcium homeostasis in the rat's hippocampal neurons. It also inhibited beta-amyloid-induced neurotoxicity by increasing CART, cocaine and amphetamine-regulated transcript in the cortical neurons. Found widely in the brain, CART functions in preventing energy loss and in preserving mitochondrial function. Mitochondria are known to play a key role in increasing energy production for brain cell survival during a stroke. The icariin also promoted brain cell survival during a stroke by increasing the sirtuin-1, which is an enzyme that promotes cellular stress resistance in animal studies. It activates the PGC1-alpha pathway, which is known to promote mitochondrial biogenesis and energy metabolism. Also, SIRT1 can reduce oxidative stress, a key factor involved in protein and DNA damage in the cells. Icariin stimulated neurogenesis by activating dormant neural stem cells in animal studies. Icariin exhibited heart protective effects in many animal studies. It improved heart function and reduced tissue death in rats with an acute heart attack by activating the PL3K AKT pathway, which plays a critical role in cell survival. It also prevented heart muscle cell death during reoxygenation following an acute heart attack by increasing BC1-2, an anti-cell death factor, and decreasing BAX, a pro-cell death factor. These effects are in part due to the activation of the PL3K AKT pathway, which increases the BC1-2 in the heart muscle cells. In another study, icariin inhibited heart muscle cell death by suppressing matrix metalloproteinase activity in the rats with heart failure. These are enzymes involved in heart remodeling after an injury. The icariin also improved heart function by reducing oxidative damage in the mitochondria of diabetic rats' hearts. The icariin may also improve blood flow to the heart by widening the heart vessels via the inhibition of the calcium channels, which helps to reduce the risk of heart, stroke, and tissue death. Arterial hardening or atherosclerosis is a common cause of a stroke and a heart attack. The icariin can reduce the risk of hardening of the arteries by lowering cholesterol levels in the blood, as was seen in a study in rabbits. Multiple studies show that icariin can promote new heart muscle cell formation by inducing cell death, increasing reactive oxygen species generation, and activating the P38 MAPK and the NF-kappa B pathways in mouse embryonic stem cells, and this suggests the icariin may have a potential application in heart tissue engineering. Icariin reduced intestinal inflammation and it improved disease symptoms in mice with irritable bowel syndrome. Furthermore, it improved airway inflammation in asthmatic rats. It also inhibited the activation of NF-kappa B pathway in lung tissue, which is involved in inflammation. Another study showed icariin decreased lung inflammation by inhibiting pro-inflammatory markers. Multiple sclerosis is an autoimmune disease where T cells attack the brain's nervous system, causing axon damage and disability. The icariin improved disease symptoms in mice with induced MS by suppressing the production of T cells and Th1 and Th17 cells. Icariin increased the production of toll-like receptor 9 in mouse macrophages. The TLR9 is a protein that functions in pathogen recognition and activation of the innate immune response. Icariin reduced physical fatigue and it increased endurance in mice during a weight-loaded swimming test. In this study, the icariin increased blood glucose, hemoglobin, and glycogen levels, all of which are known to improve speed, endurance, and exercise ability. It also decreased blood lactic acid and blood urea nitrogen levels, indicating the compound might reduce protein breakdown to produce energy and delay the buildup of lactic acid, both functions known to prevent fatigue. New blood vessel formation improves stroke-related tissue injuries and wound healing by increasing oxygen and nutrients to the affected area. The icariin stimulated blood vessel growth in human blood vessel cells, and these pathways are associated with generation, movement, and structural shaping of blood vessel cells during blood vessel growth. PDE5 inhibitors enhanced circadian response to light and decreased the amount of time necessary for re-entrainment in mice. This helps when you fly eastward. Imagine you fly east 3 time zones from California to New York. If you normally go to sleep at 11 p.m. Californian time, then you'll be going to sleep at 2 a.m. New York time. If you want to go to sleep earlier, you need to wake up earlier and advance your cycle so that you go to sleep earlier and you wake up earlier. The icariin and the PDE5 inhibitors can help to advance this rhythm. Icariin protected DNA from radical-induced damage by reductive oxygen damage. Icariin also delayed aging in mice by increasing the SIRT6. This enzyme promotes DNA repair and energy metabolism, and it inhibits NF-kappa B pathway, which is involved in cellular aging, death, and inflammation. It also delayed aging in worms by promoting stress resistance, muscle function, and movement, and preventing protein buildup toxicity. In one study, icariin inhibited biofilm formation by Propionibacterium acne, in part by killing the bacterial cells. This bacteria is linked to the skin condition of acne, indicating the horny goatweed may be useful as a natural treatment. Icariin inhibited tumor formation in various types of cancer cells, including breast cancer, leukemia, Burkitt lymphoma, and liver cancer. In stomach cancer cells, the icariin suppressed tumor cell movement and invasion by inhibiting the RAC1-dependent VASP pathway, which is involved in cellular motility. In another study, the icariin suppressed the attachment and the movement of stomach cancer cells by inactivation of protein kinase A, an enzyme known to promote cell production and survival. Icariin inhibited gallbladder cancer cell production and induced cell death by suppressing NF-kappa B activity. The NF-kappa B pathway plays a key role in cancer cell survival by increasing anti-cell death factors, survivin and BC1. Icariin also triggered liver cancer cell death by activating the ROS-JNK dependent mitochondrial pathway, which plays a role in initiating cell death. The horny goatweed has many mechanisms of action. It inhibits PDE5. It increases cGMP. It increases neuronal nitric oxide synthase. It increases free-form testosterone in the blood. It inhibits tau protein, decreased superoxide, which increases superoxide dismutase activity, and decreases malondihyde. It inhibits NF-kappa B. It elevated BDNF in the hippocampus, or the memory center of the brain, and it increased acetylcholine in the hippocampus, also the memory center. It increases CART, it increased SIRT1 and PGC1 alpha, and increases catalase. It decreases cortisol stress hormone. It increased bone morphogenic protein. It inhibited MPP activity. It decreased creatine kinase, ischemia-modified albumin, and lactate dehydrogenase. It reduced levels of total cholesterol and LDL cholesterol in the blood. It increased blood glucose, hemoglobin, and glycogen levels. It decreased blood lactic acid and blood urea nitrogen, and it inhibited insulin and IGF-1. For more information about herbs, supplements, and natural treatment plans, check out my website.